District leaders are staring down a math problem that gets harder to solve every time the bell rings. The volume of student mental health crises is accelerating, and the resources to manage them are not keeping pace right now. The financial safety net that stabilized districts during the pandemic is gone. ESSER funding has officially ended for most public schools, pulling millions of dollars completely out of local operating budgets overnight. This chart illustrates the collision. The bottom line tracks the expiration of those federal relief dollars. The top line tracks student need, which has expanded to a point where nearly half of identified cases lack a corresponding clinical referral. That deficit is the 48% gap. This gap represents the students your teachers and counselors have already flagged for intervention. They sit on wait lists or navigate the school day without the clinical support your team recommended. Trying to bridge this capacity deficit with a shrinking federal wallet is the central structural challenge facing every superintendent and counseling director today. The instinct for most districts is to try and close this gap internally. You post job openings, hoping to expand headcount and bring full-time specialists into the building. But those job postings are sitting empty. The local pipeline for school psychologists, licensed clinical social workers, and specialized counselors is effectively dry. Whether you are in a highly competitive metro area or a rural county, the hiring market simply cannot produce enough qualified candidates fast enough to match the volume of incoming student referrals. This forces a distinct choice at the board level. You can continue waiting months for a local candidate who might never apply, or you can rethink the delivery model entirely. The math is stubborn. Local hiring cannot physically cover the volume of that 48% gap. Closing it requires tapping into clinical capacity outside of your immediate zip code. Right now, relying entirely on internal staff forces your counselors to absorb an impossible caseload. They become triage workers rather than providing sustained therapeutic care. This brings us to the alternative, a dedicated clinical partnership, specifically integrating a service like MentalSpace School, which assigns a dedicated team of licensed therapists to your district. Comparing the two models reveals stark differences. Internal hiring means waiting lists, while MentalSpace offers same-day teletherapy. Financial mechanics flip from draining general funds to direct insurance billing. Finally, administrative burdens like HR and medical compliance shift entirely to the vendor. Removing that back-office burden means your team does the upfront work of communicating with parents. You'll need to guide your community through third-party consent forms and explain how billing works. You're trading the direct control of an in-house employee for instant, externally funded clinical scalability. The most common hesitation from administrators is that bringing in a telehealth vendor will undermine or replace their existing school counselors. Successful districts use a layered model. Counselors remain the trusted front line, identifying crises and assessing students. MentalSpace operates behind them, handling medical treatment and complex billing. A strict communication protocol keeps both teams in constant bidirectional contact regarding student progress. Districts establish a dedicated private space where counselors introduce students to telehealth, bridging the school environment directly into a focused clinical session. The healthiest integration uses the external partner solely as the clinical engine, while your district firmly holds the steering wheel. Building the backend to support clinical therapy is incredibly complex. It requires robust privacy safeguards, secure data storage, and a dedicated billing department. Adopting a pre-built infrastructure that is already fully HIPAA and FERPA compliant saves your district from having to engineer and audit those systems from scratch. MentalSpace is in network with major providers like Blue Cross Blue Shield, Cigna, Aetna, and United Healthcare. Most crucially, out-of-pocket costs for Medicaid families are exactly $0. The trade-off is straightforward. Administration escapes medical billing headaches, but families now interface directly with a third-party financial system to process their insurance claims. Shifting this infrastructure requirement to a vendor protects your depleted post-ESSER budget, while ensuring vulnerable students still get reliable access to clinical care. Beyond the clinical crisis, leaders face a new wave of legal pressure. Statewide student safety mandates are rapidly landing on local school board desks. For districts in Georgia, the specific mandate in play is House Bill 268. Schools must now secure formal compliance support for specialized mental health protocols. The implementation deadline hits in July 2026. This leaves districts a finite window to establish the necessary crisis intervention and suicide prevention protocols required by law. Integrating a turnkey clinical partnership like MentalSpace explicitly aligns your district's mental health operations with these upcoming state requirements. While this ensures you hit your mandate deadlines, you must recognize the reality of the arrangement. You are legally tethering a portion of your district's regulatory success to an external vendor's execution. Let's look at specific district profiles. You're a prime candidate for partnership if you're navigating a severe post-ESSER budget crunch, hiring is stalled, and you face the 2026 deadline. You should pause if your region has surplus clinical talent, or your community strongly resists telehealth. Making this decision requires a clear-eyed look at your local realities. The goal is a structural capacity plan that is mathematically viable and clinically sound. A partner like MentalSpace can solve the clinical capacity shortage and handle the billing infrastructure, but your district must actively steward the community's trust and manage the frontline relationships, because that is the one thing you can never outsource.